Good afternoon. My name is Sherry Bailey, and today I'm doing my video on the timeline, budget, and evaluation of my capstone project. The first thing, my capstone project is about increased breastfeeding support for improved health. The first thing that I have to do whenever I look at my timeline would be to ask nurses to volunteer and come up with some sort of a team to research and put together a breastfeeding risk factor assessment for people that come in planning to breastfeed. This team will be comprised of 2 to 3 nurses and will be put together by October 23rd, 2020. The team will have researched and put together that risk factor assessment sheet by November 4th, 2020. The next thing necessary to be done is to put together a presentation that will include all the information, facts, plans, potential budget, and present it to the Director of Labor and Delivery. This will be done by November 11th, 2020. Once the director has approved the project, she can assist in making any necessary changes to the plan or the budget, or just the project in general. And then it can be presented to the CNO, CEO, and any other necessary upper management personnel that would need to know in order to approve it. One thing that would be really important in including in this presentation to these people is how the hospital compensation will be directly affected by this project, like if it's successful. Breastfeeding is a core measure and it's benchmarked. So if the amount of women that end up breastfeeding go up, then our compensation will increase. So this presentation to this upper management personnel will be done by November 25th, 2020. Once the project is fully approved by everyone, the next step would be to get a lactation consultant or consultants to actually start visiting patients in the hospital. These consultants will officially start working by December 28th, 2020. The nurse and the consultants will have to work together to utilize the risk assessment tool along with all other standard practices to assist mothers with breastfeeding and identify mothers that are at higher risk for early breastfeeding cessation. The program, the whole capstone project, will officially be initiated by January 4th, 2021. So, these consultants will visit all patients within the first 24 to 48 hours of delivery. It's important to provide early breastfeeding support to mothers. However, it's better received by mothers when it is in person by one individual that is trusted for the first 7 days, A unique care plan will be utilized based on the mother's risk factors and needs in order to improve support on an outpatient basis. Mothers that are at increased risk for early breastfeeding cessation are women who are first-time mothers, have had subjective emotional distress during pregnancy, and moms that have given birth via C-section. They're going to set up follow-up phone calls or meetings within 1 week of discharge, and will continue those follow-ups via phone call up until 6 weeks postpartum. Then after they've met by phone call or in person, depending on if the mother wanted to set up a meeting for 6 weeks, they will continue based on the mother's needs. So if the lactation consultant thinks the mother needs more assistance, they can continue with those phone calls and meetings. If not, they can just follow up after 6 months postpartum. Information will also be given to the patients regarding support groups in their area. The patient will also be able to set up in-person meetings with their lactation consultants if they need further assistance. So all of this information will be presented to them. Okay, so the next thing I looked at was the budget. When evaluating the budget needed for this project, the first thing that needs to be evaluated is the number of hours that the nurses volunteering to help have to put in order to come up with this assessment tool and put together a full plan of action and those presentations for the director and upper management and stuff like that. So as I said, I think it would be best to have 2 to 3 nurses. 3 would obviously be better, but 2 if we wanted to decrease the amount of money spent. And they would be putting in about 64 hours each for about a week and a half, based on that timeline that I presented, to just get everything together in order, have all the research facts presented in a presentable manner. So this would lead us to spend, for 2 nurses, it would be about $4,480. That's just like their salary. And then for 3 nurses, it would be about $6,720. The other part that will need to be budgeted for is the day that the presentations are done. So people possibly would have to come in on their day off. So let's see, for the director of labor and delivery and the presentation for upper management, so that's 2 presentations. The presentation will be about an hour long. So that would cost about $140 for 2 nurses to present and $210 for 3 nurses to present. The next thing would be the lactation consultants. However, I came up with a plan. If we could utilize an agency in the area, the hospital could come up with some type of contract. This contract would allow the lactation consultants to come into the hospital and see new patients. Without, the hospital wouldn't have to pay anything. Their agencies would pay them, but they would be benefiting from it because they would be able to see more patients and therefore make more money. And that would be based on that contract that's brought together and presented to the lactation consultants. So they would be getting paid more because they would be seeing more patients. So how we would evaluate this plan? Evaluation of this plan would be based on statistics and postpartum follow-up. There would be a paper that the lactation consultants would fill out during their follow-up phone calls and meetings that would involve questions about their current breastfeeding goals, if they're still breastfeeding, if they're not still breastfeeding, when they stopped breastfeeding, how long they breastfed for, and the reasons that they stopped. And lastly, how they felt about the support that they received for breastfeeding during that postpartum period. They would also ask then if the patients thought that there could be any improvements to the program that we have set up. Every patient will have a final follow-up phone call made at 6 months postpartum. These questions will be asked and we'll evaluate their responses from mothers for a full year for the initiation of the program. So we'll look at the results in a year after we've started the program. If the length of breastfeeding has increased overall, we will know that the program was a success. If the length hasn't increased, we can then go back and look at things that need to be improved, changed, or just completely revamp the program if necessary. We will also have those questions that we asked. We asked the moms if they could improve, if we could improve on anything. We can utilize their answers to see if that might help anything at all too. Overall, our evaluation will be based on what is reported back to us.